Hello, I'm Dr. Geoffrey. You want to watch this video. If you have an older loved one or a person of color, this video may help save your life as it relates to COVID. The evidence is in. Appropriate vitamin D levels will save your life as it relates to COVID. Even prior to the newest study, some studies have already shown that being vitamin D deficient makes you 10 to 12 times more likely to have a negative outcome as it relates to COVID. So the question is, who's at risk? I'm going to get to that, but real quick, let me tell you how vitamin D works. Vitamin D, view that as the regulator of our immune system. It's the regulator. It's on every single molecule. It's the referee. It's on every single white blood cell. It's the referee. Well, when the referee's gone, there's an overinflammation, there's an overreaction of our immune system. Hence, what does COVID do? It goes to our lungs and there's an overreaction, overinflammation. That's how vitamin D works. Follow me. There are certain groups that are at increased risk for vitamin D deficiency. Older people and people of color. Here's why. 90% of our vitamin D comes from the sun. 9% comes from the sun. But older people, as a result of getting older, the skin changes that go along with that getting older, they're less efficient at converting sunlight to vitamin D. And then people of color, the darker your skin, the less efficient you are at converting sunlight to vitamin D. Let's look at the numbers in this country. In the United States, 32% of Americans are vitamin D deficient overall. Put in the chat, how many Americans? Put in the comment section. But how many black people are vitamin D deficient? 82% of blacks are vitamin D deficient. 64% of older people are vitamin D deficient, and 70% of Hispanics are vitamin D deficient. Follow me. Who does COVID impact the most? Older people and people of color. In no way am I saying that vitamin D is the end-all cure-all. It's just another data point. But what I am saying is that the studies are very clear. If you are vitamin D deficient, you are, one, you're more likely to contract COVID. You're more likely to contract COVID. And then two, you're more likely to have a negative outcome. What's the take-home point? In this crisis that we are in, you want to make sure you maximize everything. You want to be sure that you're not in that group who's vitamin D deficient. I would talk to your primary care doctor about over-the-counter vitamin D supplementation, but you can also increase your vitamin D from your food. Dairy products are rich in vitamin D, and then also fish, fatty fish, like tuna, mackerel, and salmon. But again, in this COVID fight, in this COVID crisis, you want to make sure that you exercise leadership within your household and actually leadership within your own life to make sure that you're not vitamin D deficient. In the meantime, I encourage you to wear a mask, face shields, socially distance, and do your part. We're all going to get through this, and I would encourage you to look out for one another and be kind. Thank you very much.